Hi, my name is Ilona. I'm a physiotherapist and I work at Bay Active Physiotherapy in Double Bay. And this is a really handy piece of equipment that we use at the clinic to treat a range of conditions such as stiff backs, tight muscles, or progressing some of your core exercises for some of you who have lower back pain. So I'm going to get Emily to demonstrate some of those exercises to you. The first one we're going to do is rolling out your back for some of that stiffness in your mid back, lower back or upper back. So I'm going to get Emily to lie on the foam roller vertically first. So you sit on the edge and you lean back. Your feet should be directly underneath your knees and about hip distance apart. They should be facing straight, not turned out. Your lower back should be neutral and your rib cage should be flat down on the foam roller. In this position, I'll get you to first pop your arms down flat on the floor, palms down. And what you can do is you can rock from side to side using your feet, pushing through your heels, just loosening up those stiff joints in your back. Making sure that your chin is also tucked in so you're not hyperextending through that neck. What you can also do is stretch out through the chest, so the pecs. Some of you might have really tight pecs. And what you do is you turn your palms the other way and then you slowly start to creep up until you feel the stretch. And if it starts to hurt, then you stop there. What I would do is I'd lie here for about 3 minutes until the pecs release in their tension. Another way to stretch is if you put the foam roller horizontally. So I'm going to get Emily to stand up. So it should be sort of starting at your mid back, and then you lean back, clasp your hands together, pop them behind your head to support your neck, and then feet directly again underneath your knees. And when you're ready, lift your pelvis off the floor and you roll up and down your whole spine. So you can even start from the lumbar spine, which is your lower spine, working all the way to your thoracic and your upper back. So I would use the foam roller every day for a few minutes a day to release some of that stiffness and tension in your back. Yeah, it should feel like a really nice spinal massage. You may even get some cracks in your back, which is normal. Now I'm going to show you how to use the foam roller for your core exercises, which is a really great progression for some of you who want to build your tummy strength and prevent lower back pain. So you sit back on the edge, you lean back, pop your palms flat on the floor. Again, feet directly underneath your knees, hip distance apart. Make sure they don't roll out or too far in. Tuck your chin in and rib cage flat on the foam roller. Neutral spine in your lower back, so imagine there's a little gap there. You tighten through your lower abdominals, so imagine that your lower abdominals are pulling down away from the waistband to activate through the core. Make sure you're also breathing, not holding your breath, and you start with a tabletop position. From here, you can progress to a leg extension, which is quite challenging for the core. You bring it back and you alternate to the other side. So tabletop first, then extend, back and down to the floor. Another really good exercise just to show you for the core and the glutes is the bridge. So with the bridge, you tilt your pelvis back, you slowly and gently start to peel off each vertebrae off the foam roller, squeezing your buttocks to activate through the glutes and tightening through your lower abdominals to activate through the core. Then you slowly start to peel back down each vertebrae at a time, making sure that you have that articulation of your spine and that you're breathing at the same time. Those are just some of the common examples of core exercises that we do at the clinic, and the patients can take the foam roller home and perform them at home themselves.